Well, new COVID cases across the country are plunging, but China and other parts of Asia and Europe are seeing an uptick.
Is another surge inevitable, or is the pandemic behind us?
Dr. Jeff Potoff is on vacation this week, so we've invited Dr. Dan Shirley to join us. He's the Medical Director of Infection Prevention at UW Health. Doctor, thanks for being with us today.
Hi, Dr. Shirley. Good to see you.
Hi, thanks for having me.
Where are we in the United States in terms of the pandemic?
Well, as has been reported, the cases are way down, and that then a few weeks later results in hospitalizations being down. And we're in a pretty good spot, actually, as far as cases. I think right now we're in a position to spend some time watching closely what's happening in Asia and Europe, and monitoring closely for our cases here, both how many there are, but what types they are, what variants.
What variants and subvariants concern you? And do you expect what's happening in Europe to eventually come here? Europe is usually, with the previous wave, about 3 weeks ahead of us here in the United States.
Yeah, here we watch the types of variants too, and there is a kind of a replacement going, so a little switch from the Omicron that we had before with the surge and this BA2 version that's happening in Europe and Asia right now. And so it is overtaking here. It's just that the cases have stayed low despite that switch. Basically we're watching for an uptick in cases at this point. I think some of the things that might benefit us are that we just had this huge Omicron surge. So a lot of people were infected, and we know that there is some immunity from that. The issue is more about not knowing how much immunity people get from different versions or severity of infections, and then how long that lasts. That, though, paired with the immunity from vaccination, does create a little bit of a protection all at once right here. And hopefully, as we go into nicer weather, people get outside and spread out, we'll avoid big surges.
What's more important to watch, the number of cases or the number of hospitalizations?
Yeah, it's a good point. The biggest number one priority is to prevent hospitalization, severe disease, and death. We see, as we're watching in Europe and Asia, that countries that had high levels of vaccination are having fewer hospitalizations and death than the ones that might have locked down and not ended up with vaccination of certain people or Omicron protection from getting the infection itself. So in Hong Kong, for instance, they hadn't vaccinated a lot of the 65 and older population, and so they're having a lot of trouble with hospitalizations and severe disease right now.
Should we still be getting tested?
Absolutely. I think the way to think about it right now is that, if you have symptoms, we still want people to isolate and protect the people around them and get tested. And that still could be going to a place to get a PCR test, which will allow us to do the sequencing, that type of thing, or doing a home test if that's the option for you. The other reason to test right now is that we have more treatments. And so if you're a person with medical conditions, immunocompromised conditions, getting tested will allow quicker treatment and hopefully protect against that hospitalization problem.
Where do we stand for another vaccine, for another booster shot?
Yeah, so obviously we're researching that. Who would benefit from another shot? When is that shot the right? What's the right time to get that? People who are immunocompromised already have been considering, and a lot of people have been getting a sort of extra shot. And there's some research in other countries that it might be helpful for people who are 65 or older. That hasn't been rolled out in the United States. They're kind of reviewing that data and of course, waiting for more data to see when is the best time.
We're still questions about this 2 years into it.
Yeah, it's ever evolving.
Mm-hmm. Exactly.
Well, Dr. Shirley, thanks for being with us today. Great information.
We really appreciate your time. Thank you so much.
Thank you, guys.
Well, a final check of your forecast coming up.